Hey guys, Dr. Brandon Crawford here. I'm the founder of the Austin Center for Developing Minds. We are located just north of Austin, Texas in Cedar Park. And what we do is we focus on developmental functional neurology. Hopefully you'll have a chance to catch my lecture because I'm going to be taking you through what that process looks like and why it's so important to focus on rehabbing the brain in the right way, at the right time, with the right frequency and oscillations and all this kind of stuff, right? So I'm very honored to be a part of this conference. This conference is very meaningful. I love all the people involved, and obviously the cause is fantastic. So thank you again, and I look forward to seeing you soon. Hey everyone, Dr. Brandon Crawford here. So I am co-founder of the company Shed Light. Shed Light is a company that focuses on the use of laser and light therapy to improve the health and wellness of the brain and body. We're happy and excited to be a part of this conference. And so, if you have any more questions or want any information regarding how laser and light therapy can improve your health, please check us out. Go to shedlightcoldlasers.com. Thanks.
All right, so thanks for having me, and I appreciate the opportunity to present this topic to you guys. This is one that's near and dear to our hearts here, and I'm going to be talking about cellular therapy for neurologic injury, what many people are familiar with as stem cell therapy. And I'm just going to get right into it. So thanks for having me. There we go. So I'm going to talk about who we are, why we're here and in this space. We're going to talk about some examples that demonstrate hope for neurologic injury at both the adult and the pediatric age groups. We're going to talk about stem cells and how they really work. And we're going to talk about some misconceptions about stem cells and cellular therapy. So first, who am I? I'm Dr. Vassily Eliopoulos. I'm a traditionally trained doctor, Trinity College for undergrad, Peace Corps volunteer in between undergrad and medical school, then medical school at Cornell University Medical College in New York. I came out here to Colorado to train in an internship in general surgery, and then completed my training in emergency medicine. And I'm a diplomate of the American Board of Emergency Medicine, which basically means I'm board certified in emergency medicine. I don't have on here the years of additional training in regenerative medicine. There's no formal training program for regenerative medicine or stem cells at this point. So the people who are practicing it have had to find sort of their own way to educate themselves. We've been practicing in this field for years, and it took years of additional training on top of what you're seeing on your screen to be able to do what we do here. My partner, Dr. Latif Sai, is not presenting with me today, but he is integral in the content that you see and helping me plan. And so although I'm the voice, I really feel like this presentation is equally his. He's a huge asset support for me, and he's one of the smartest people I know. He's trained at University of Missouri, summa cum laude, double major, Dartmouth Medical School, Yale for emergency medicine, also board certified in emergency medicine, and also years of additional training in regenerative medicine. We typically start in the medical field with disclosures, particularly to point out any financial disclosures. Rocky Mountain Regenerative Medicine is a private practice. We do support our families through the work that we do here. And so, unfortunately in medicine, maybe that does constitute a conflict of interest. And I feel like it's important to say that. I think a lot of doctors kind of skip over that fact, but that's the only disclosure we have. We don't have any financial relationships with any pharmaceutical companies, any biologic development companies. We don't get any kickbacks, and we feel that that's really important to be able to provide the highest level of service to our clients. And to address the first issue is that I don't do anything here that I either haven't done to myself first or that I wouldn't feel comfortable doing to myself or a family member. And that's sort of the standard that Dr. Koshal and I use for the therapies we use and the interventions that we make here. Why are we here? Dr. Koshal and I came from traditional medicine. And as you probably know better than we do, the current medical setup is broken. That's not to say that there aren't amazing things that traditional medicine can do. There are times when you need traditional medicine. There are things that and outcomes that only traditional medicine can achieve. However, the system is fragmented, it's distant, it's complicated. That's going into that is a whole nother lecture, but we know that you as the patient in the middle of this sort of diagram with multiple specialists, fragmentation, often poor communication, what can happen is people get lost in the system, and the providers feel that too. And Dr. Koshal and I were not happy with our experience on the provider end of this system, and we were looking for something different. What we came to was the practice that we have now, which is the focus that we take is on biologic solutions, really enabling the body to heal itself. And the body has incredible potential to take care of its problems if you allow it to do what it needs to do and sometimes give it a little bit of an extra helping hand. The important thing about regenerative medicine, or what you might know as stem cell therapy, the focus is on the patient. It's not on a symptom. It's not on a pharmaceutical. It's not on a synthetic derivative. It's really using and enabling the own patient's biology to help heal itself. And I feel that it is clearly the future of medicine. Talking about why, there are issues with adopting this, again, is a whole nother lecture, but we are here because we feel that this is the future. Part of this is understanding the root cause of what's going on. And so I feel like it's really, it really is a new paradigm. So we created a practice around these therapies, which many of you have heard of as stem cells, but the reality is that regenerative medicine goes far, far beyond typical, what most people consider stem cell therapy. We started in that arena where stem cells or stem cell therapies, which I'll use interchangeably during this talk, stem cell therapy and cellular therapy or biologic therapy. They have different meanings, but for the purposes of this lecture, I'm going to kind of bundle them all into one topic. But cellular therapies are most commonly used for orthopedic injuries in adults, degenerated knees, torn ligaments, bulged discs. There's now, sort of another offshoot where they can be used for aesthetics to help you, look younger, to help hair grow better. And stem cells and cellular therapies work well for all these applications. What Dr. Koshal and I found was that the healing potential of biologic therapies are not limited to these small niches where they're applied currently. They have the ability to heal all over the body. And if you understand how these therapies work, they can be used in a whole range of disorders that are not traditionally considered within the scope of stem cell therapy. So for example, neurologic injury. And because of our expertise and our decades of experience in the acute traditional setting, we've been able to sort of push the boundaries in the types of conditions that cellular therapy can be used for. And that led us, into some clinical trials, which are currently ongoing. One of the indications for which is brain injury. And so our first foray into this was actually in the adult patient population. And I'm just going to show you, an example. What we found is that these therapies have the potential, they have the potential to be incredibly powerful to help the body heal, particularly in this setting where traditional medicine doesn't have an option or doesn't have a therapy. And so this, I'm going to show you this because this was one of our first, what I consider major successes with a central neurologic injury. And I know it's different from the types of central or brain injury that perhaps a lot of you are concerned with, but the healing process works the same. And if you understand how stem cells work, they can be applied in a way that can be very effective. And so I'm just going to show you this. This is an adult patient. He's going to briefly describe what happened. He broke his neck. He had a spinal cord injury and he was paralyzed basically from the nipple line down.
Fall broke my neck. It's C3, C4. Was paralyzed from nipple line down. Most movement was getting. I was a toe wiggle and on my left foot only. Now I've got arm movement. Fingers very minimal. I can move my left leg controllable. Right leg, it's very hard. I can't pick it up off this right now. I've been going through 6 months of intense therapies at Craig to get what I've got. My station is strength. Yes, I had an uptick. I have started working on a self-propelled regular wheelchair. And then it just show me just briefly, before I could hardly move. Yeah. And then the right leg, even though the one that was behind, which I remember you couldn't move it all. I couldn't move it all. Right. I'm getting more. It's less dramatic. Yeah. Than the left.
So you can see for yourself that, this is somebody who in the traditional medical setting would be given physical therapy and occupational therapy. And, in all fairness, 1 in 12 of these spinal cord injuries can end up walking again as long as they're incomplete. And I want to be careful to say that I think this patient, as he told you himself, that he feels that the interventions that he's made with a biologic therapy change the trajectory of his rehabilitation. But I think it's really important to emphasize that this isn't just a shot, you get a treatment, and suddenly you get miraculous changes. It takes effort. He's engaged in aggressive physical therapy, occupational therapy, and when I've talked to his traditional doctors, on the team that currently works with him, neurosurgeons, neurologists, they will credit all of his progress to his aggressive physical therapy and effort. And this is where traditional critics can say, well, you don't know if the stem cell therapy helped him get that, and there could be a placebo effect. And granted, yes, there are caveats, of course. But when you see these types of therapies applied in a way that can get somebody the types of results that prior to the therapy were considered, if not almost impossible or impossible to achieve, personally, when you see this again and again and again, it changes what I think is possible. And so I don't want to say that the stem cell therapy got him all of the gains, but I'll use his words, is that he thinks it was an important part of his long-term rehabilitation. And he's still not walking independently. That's his goal. But he is now, you see how he's moving now. Both he and his physical therapist and his traditional team do feel that he is going to be able to walk again. So, we entered regenerative medicine, and doing traditional things. We've been able to push the limits into a realm where most clinics are not comfortable going. And I think a lot of traditional doctors and their skepticism come from the fact that in my opinion, there's nothing in medicine that is as well known and as poorly understood as stem cell therapy. And we're going to get into why in just a minute. But once traditional doctors understand what we know, when I have a conversation with them and am able to explain what the stem cells are doing, often it takes a reluctant provider or a skeptic and at least opens to them the possibility of a biologic potentially playing a role for somebody with a brain injury. And so now I'm getting to, okay, how do we end up in pediatrics? So, you know, we're enrolling patients, mostly stroke or post-spinal cord patients for neurologic injury, using biologic therapies into our IRB approved protocols. And I have a neighbor who has a child who suffered a brain injury, a placental abruption at birth, hypoxic ischemic injury. And he's a neighbor. I see them at the supermarket. And she came to me and said, I want to do stem cell therapy for my son. And traveling with a disabled child is incredibly difficult. And we want to do it here in Boulder. We want you to do it. And I went to Dr. Koshal and I said, this is an area where skeptics could really, I think, come up with serious criticisms. And the criticisms that I've heard are, you could be preying on, these poor parents who are desperate to do whatever they want, and with an unproven therapy, or you're experimenting on children. And so we were really, really reluctant to do this, but she convinced us. She's a well-educated mother. She had done her research. She, after multiple phone calls and then finally visits the office, really wore us down. And finally I said, okay, I get that you get it, we get it. We're gonna do a one-off. And I'll tell you, there's nothing that gets you to test your convictions until it gets close to home. And this is not the mother and the client. This is actually my wife and kids. I didn't have permission or picture to use there, so I didn't want to put that up. But, this is there for a reason. If this is somebody that my kid can play with down the block, I want to make darn sure that we're doing it right, that we're giving this therapy a chance for success, that we're not going to have a serious complication. And yes, I know you can't guarantee any of these, but I have this here because nothing really gets you to test your convictions and your belief in your therapies until it comes close to home. And that's what she convinced us to do. And I'll tell you, from my personal, what I saw with her son was, when I see him before and after, I don't I'll admit, I don't see a huge difference. But I will tell you, for this family, the difference was significant. And it impacted both Dr. Koshal and I to the point where we said, wow, I didn't believe it was going to have this much of a positive effect on this family. And even though I don't see as much of a difference as I would hope, like we did with a prior spinal cord injury patient, I mean, that's easy to see, but for the parents of a child who's disabled to get improved function to the point that their lives are better, they're sleeping better, they're more comfortable with the child and the safety and their safety at home. The change to us and being able to witness that as a neighbor was profound. And so that planted the seed for us that there's something, we believe that there's something here. And this sort of got us to where we are now, which is, I'm going to talk to you a little bit about. Now we've done dozens of children. It's on an IRB approved protocol that was put through for adult patients, but there's no exclusion for pediatric patients. And so with the permission of our overall group that oversees these IRBs, this graph is now data from these 23 children from last year. So there's maybe twice that. We don't enroll everybody in the study and collect data on them, and sometimes there's personal reasons for that. But and success rate. I know a hard academic is going to say, okay, this data, this is based on subjective improvement by report of the parents. Okay, so this is not controlled. I know it's not perfect, but the point that I feel is important to make is that I believe there's something here. I've seen profound changes in both patients and families, and we'll get into pediatric case a little bit later. But when you have a family who has a child who can't roll, who can't sit up, who can't hold their head up, and you do an intervention that enables them to, that appears that, and I should be very careful, we do an intervention and it appears to both the parents and to us, and of course, we could be conflicted because we have a dog in this race. I want the therapy to work, right? So do the parents. So a hard academic would say, well, this is imperfect data. You don't really know. But what I say is I'm doing the best. We're doing the best with what we have now. And 70% of the patients that we see report improvement and would do the procedure again, which means there's about 30% who don't see improvement and wouldn't, and I'm putting some words in their mouth, who wouldn't do the procedure again. But let me be very clear. We've had no significant safety issues, no seizures, no meningitis, no serious, nobody's gotten worse. So as we do these cases, we're accumulating safety data. And really what I would love is for some big, the University of Colorado or some big institution to really take this and do a hard double-blinded placebo-controlled study. As a 2-physician private practice, we're not set up for that. We've applied for funding. We haven't been able to get it. I'd love to be able to offer these therapies for free to families. We need academicians to pick up the ball here. And I hope that the data that we're collecting, limited as it may be, is something that will help push this narrative into the mainstream medical community. But besides the point is, the reason why I'm showing this, the vast majority of people feel that it's given them significant improvement to the point that they would do it again. Anyway, so how does it work? Okay, so we've seen it can work. We've seen that the most people who do it feel that it's been significant for them. How does stem cell work? So this is, and I think this is, again, nothing is as widely known and misunderstood as stem cells. This is what most doctors think when they say stem cells. You have a cell that comes from, a totipotent cell into a multipotent cell. What that means is this cell can turn into many different types of tissues, and you have an injured tissue, you put a stem cell into that injured tissue, and if it's injured heart muscle, it'll turn into new heart muscle, and if it's injured neuron, it'll turn into new neuron. That's how most doctors think these therapies work. That's how most patients think these therapies work. And that's how, frankly, most doctors who do these therapies think these therapies work. And I'm here to tell you that that's not how these therapies work. And I think if people understood how these therapies worked, they'd be more apt to understand how they could affect change in something like pediatric brain injury and why it is potentially beneficial. So that's what we're going to go over. So how do stem cells really work? When we talk about stem cells, most people think of bone marrow, okay? The reality is that peripheral tissues, the tissues outside of the bones, harbor many, many, many more stem cells than there are within the bone marrow. And these stem cells live, this is a scanning electron micrograph of a blood vessel that's bridging into a capillary bed. So larger blood vessel bridging into smaller blood vessels. And this red cell is what is called, is a mesenchymal stem cell. There are a number of different terms of pericyte, as in P-E-R-I, because it hangs out around the blood vessel. It has tendrils that sort of wrap around the blood vessel, and it actually dangles those tendrils into the blood as a thermometer looking for markers of injury and inflammation. They're all over the body, here, in the brain, in the heart, in the skeletal muscle. And this electron micrograph shows a little bit better these tendrils that sort of wrap around the blood vessels. This is sort of a cartoon image of what that looks like, blood vessel, stem cell. These stem cells live on the blood vessels and are looking and waiting for injury. When they get a signal that an injury has occurred, they go through the blood vessel to that site of injury to help organize and facilitate the healing process. So what does that look like? So we're going to go now to, this is phase contrast microscopy. It's a video. This is canine tissue. It's live tissue. This is a blood vessel here. This is skin that's been pricked with a needle. And I'm going to play this. What this is going to show you is that moving from the blood vessel into the area of injury are cells. They literally crawl through the tissue from where they're lying and waiting on the blood vessels through the blood vessels, which they use as a road or a highway, to get to the area of injury. At the area of injury, these stem cells, you can see there are dozens and dozens and dozens of stem cells that respond to an injury as simple as a pinprick. I'm going to play that again so you can see it, because I know this is subtle. These stem cells are responsible for the healing that's going to take place to repair this damaged tissue. The stem cells function like the foreman in a work team, and I would argue, at least based on our current understanding, that they are the most important part of the healing process. You'll see that for a simple pinprick, you're getting dozens and dozens of stem cells to help heal that. Okay, so here is sort of a pictographic explanation. So, okay, how do they do that? We're going to kind of go through this flow diagram of stem cells from where they live on the vasculature, responding to damaged cells, and how those stem cells help turn those damaged cells into healthy, better functioning cells. This I put is another video which demonstrates the honing ability of a mesenchymal stem cell to an area of injury. What this video is going to show is a pipette that's eluting markers of inflammation, which are the signal of injury, around a petri dish. And as this pipette is moved, you see the stem cell hones exactly to where that pipette is placed. This is how stem cells hone to areas of injury, cellular injury in your body. Like a homing beacon, inflammation and the process of inflammation serves as the homing beacon to draw in your natural healing capacity. So you have these parasites or mesenchymal stem cells living on the vascular beds in your peripheral tissues. When a cell gets injured, from whatever reason, a pinprick, lack of oxygen because of decreased blood flow, a fracture, aging, you name the injury process, the healing process follows this same program. Injured tissue sends out a signal that we're damaged, we need help. The mesenchymal stem cells in the peripheral tissues respond by going en masse to where that area of injury, where that signal comes from. What the stem cell does is it has an interaction with the damaged cells, and there are a number of different ways that this could progress. This is sort of the simplest, most common way that stem cells help heal tissue. Stem cells do an assessment of this damaged cell. Now, damaged cells don't work right. They can't multiply. They can't pass on signals. If they're a neuron, they might not be able to function at all. Just because they're not functioning doesn't mean that they don't have the ability to function if the right amount of healing can be applied. What the stem cell does is does an assessment and then releases a complement of exosomes. Exosomes are really, it's sort of like, for lack of a better term, it's the healing medicine that stem cells are able to impart onto the damaged cell. These exosomes, this exosomal communication, provides to the cell proteins and microRNA, which enable the cell to do what it needs to do to heal, okay? If this cell could heal on its own, it would do it. Part of the problem that comes from long-term disability is that you get damage, you get a healing response, and the healing response is inadequate for the actual amount of damage that's been done. And the initial stem cell response is inadequate to heal all of the damaged cells. And so I'm kind of digressing. I'm going to get back to what the stem cell is doing. But in that initial response, you get stem cells, they release exosomes. The exosomes are absorbed into the damaged cell and give the cell what it needs to heal. Then what happens is that cell can now go on to do what it would normally do, and the stem cell is freed up to either return to where it came from or assess the next damaged cell and impart exosomes to enable the healing process to progress. A healthy cell can now divide. It can now transmit messages. It brings up the level of function of all the other damaged cells around it. And you can see that one stem cell can affect multiple, dozens, if not hundreds or thousands of interactions to enable cells to heal. Okay. What happens with brain injury and with chronic injury is that the initial healing response is inadequate to completely heal the amount of damage, and that can lead to long-term disability. Okay, so what does this look like in a brain? I'm going to use an analogy. If the brain is a wall, you have a car that drives through the wall, you now have a damaged area of wall or tissue. There is an area at the periphery of this damage which is destabilized. This does not work well. And you could envision a scenario where if this isn't addressed, the whole wall might come down. But in the area that's damaged, there's actually salvageable components. Some of this is unsmashed and unsalvageable. Some of it's not. What the stem cells do when they come in is they facilitate a healing process. And particularly with brain, because brain tissue is different from a lot of other tissues, and that's sort of beyond the scope of this lecture. I could fill this whole conference with stem cells and how they work just in brain and on neuron. So forgive me if I'm sort of glossing over some of the details, but I'm trying to I really want to get you to understand how stem cells work. The stem cells come in, mitigate that area of damage, they find what's salvageable, and they rebuild the wall so that now you have a stabilized wall. There will probably be an area of damage that you're not going to be able to gain back. That doesn't mean you're not going to be able to regain full function. But the amount of damage, will sort of dictate how big the hole left in the wall is. And so with the brain, let's take a stroke because it's a simple example, a focal area of injury. In the brain, you have an area of damaged tissue and a penumbra of tissue that's destabilized around that. What the stem cells do when they come in and affect their healing process is they stabilize this tissue, they shore up the damaged neurons that are non-functioning, allowing them to function, which enables this brain and this damaged area to function at a whole lot better than it did before the interaction. What does that look like? With a specific neuron, you get a neuron that's damaged. You have a stem cell that's drawn to this signal. The stem cell does an assessment, releases a complement of exosomes. Those exosomes are taken up by and bound to proteins on the surface of the neuron, which give the neuron what it needs to heal. The neuron can now go on to function to form new synaptic and dendritic connections to conduct a signal that maybe it wasn't able to before, and potentially to divide. Okay, stem cells in the way that they're used currently are not turning into new tissue. They have the capability to turn into new tissue, but by and large, the scientific evidence is demonstrating that when used in areas of injury in live human beings, you can take stem cells from somebody else that are grown in culture, and they can turn into tissue that are not somebody else's tissue, they're the patient's own tissue. And the reason is because those stem cells are not turning into new neuron, they're facilitating healing in damaged neuron, which is enabling those neurons to form new connection and divide, okay? So what does this look like in a pediatric patient? This is a pre-video with a voiceover of the mother just describing their experience and the prognosis they were given.
I guess when he was born and we started going through all of the initial first year with a lot of doctor's appointments and neurosurgeons and 3 surgeries, it was very, very grey and bleak, and they did not give us any hope at all, and he wasn't making any progress. He basically was on his back the entire time. There was no eye contact. Every second question was, is he having seizures? And it was pretty tricky. So he kind of, he just said, just enjoying but like, that's what he said. Yeah, I love it. Yeah, just shut down a lot.
So this was a family who was basically told, your child, you know, we don't know if he's going to be able to see. We don't know what kind, he's probably not going to speak. We don't know what kind of speech function he's going to get. He's never going to walk. He's never going to use his left arm. This was a hemorrhage, a brain hemorrhage at birth. And this family didn't accept that story and that narrative. And they aggressively sought out therapies, interventions, mainly physical therapies in nature. And they saw some progress. And they came to us when George was 2. You know, normal 2-year-old milestones, normal children are walking, talking. You know, there's a lot of figuring out boundaries with no's, you know, terrible 2s. And they had a prognosis. In my conversations with the pediatricians and the neurologists that were taking care of him were, this is it. This is going to be a disabled kid. He really can't move the left side of his body. He probably is going to have significantly impaired vision if he can see at all. He's never going to talk. And we just need to accept this. And the sooner we can accept this, the better. And again, the parents, with discussion with the pediatrician, with discussion with the parents, it was clear these parents understood they are capable of making a decision. Okay. I really dislike the narrative that, oh, parents of children who have some disability, whatever it is, are not able to critically think, make a rational evaluation of what is best for their child, and to take a decision, and to make a decision that is really in the best interest of their child. Because if not the parents, then who? Then the pediatrician, then the pediatric neurologist. And so I think a lot of the critics of, you know, these therapies are discounting the capability of their patients' parents and their ability to think critically, to evaluate for themselves what is the best decision for their children. And I want to be clear that any therapy that we do, I'll go back to that graph, there's 30% that don't see improvement, okay? It's expensive. There are risks associated with it, even though, like I said, we haven't had a major complication. Anytime you do a medical intervention, there's risk, no matter how simple, whether it's a blood draw, whether it's a shot or a vaccine, whether it's an antibiotic. And different levels of interventions, the more invasive, usually the more risk. You know, when you're talking about harvesting cells, it's a minor surgical procedure, but it's a surgical procedure. And that carries risk. And you have to evaluate the potential risk in terms of the potential benefit. And I think parents are capable of making that decision, particularly when these therapies are applied in a judicious manner. Anyway, so I'm going to get off my soapbox and I'm going to show you what is possible. And this is, you know, I would call George a super responder. There are some kids that take this therapy and it's like, they respond in a way that, you know, nobody would have expected. And we don't know how to predict that yet. But here's another this is right before stem cell therapy. He's 2, okay? Or just under 2 years old.
Georgie, to the swing, sweetie.
You noticed a difference in the therapy from before and after? I mean,
100%. Because we had done the therapies that we did after stem cells, we had done it already 6 months earlier. And the gains that we got after stem cells were like
yeah.
3, 4, 5, 7, 8, 9, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. He's really on his hands and knees. Yeah, just the personality switch vision got so much better. He was able to focus and interact more.
Yeah.
Like it was, yeah. And then the second time he started cruising along the couch. So we did you and then the same therapies again. And he started cruising along the couch. And his speech has exploded.
We'll walk to there and then we'll go to the car. Okay?
Slowly, Baba.
Concentrate.
Slowly.
Look at Dad. Look at Dad.
Slowly.
So, sorry, I mean, I've seen this video. I can't tell you how many times in preparing for this video, but it still chokes me up a little bit because I never would have thought that this was possible. Never, okay? I'm a traditionally trained doctor. I understand, dealt with strokes and, I've dealt with children and brain injury and adults with brain injury my whole career. And never in my wildest dreams did I think that there could be a therapy that's this powerful. And it took a committed mother who's a neighbor, to convince us to just try. And I think part of why I feel like this presentation is important is I'm not trying to say that this is the miracle cure for all children with brain injury. I know that it's not, because I know there's a component that don't respond, and many who respond, the gains are minimal. And, I want to reflect on that because I'm showing you a dramatic case and I don't want to try to say like, this is what everybody gets. But I'll tell you what I have experienced is that when you take a child who isn't able to sit up on their own and is getting aggressive therapy and, because kids and the brain is, it is plastic. In adults as well, it's not, in plastic meaning it can change, it can develop. It can heal. Adults are not as good at healing brain as children are. And so you have a window of opportunity when the children are young and developing where I feel like they're better able to run with these therapies. But that being said, take a child who can't hold their head up and can't sit, and whether it's with the therapy, meaning the physical therapy and that intervention, or the stem cell therapy coupled with that, when you give the family ability for a child to sit on their own, that's huge. And so I would implore any academic physician who is watching this, we need the large academic institutions to get on the boat with cellular therapy. It is not a sham. It is not a joke. There is hard science behind it, and if you haven't read it and don't know it, email me. I will show it to you. I will go over it with you. This needs to be done on a level that is above our capabilities here at Rocky Mountain Regenerative Medicine. And it's not that I don't want to do it. It's that I feel that it needs to be done. And part of the reason why we continue to do this is, I know, again, we're building a body of data that's limited. It's not perfect, and I understand that. But we need the major academic institutions not do one study on whole umbilical cord blood. I'm not trying to say, I think that's awesome. I think their study's great. We need multiple teams of people on this at our academic institutions, and I personally feel like they're falling down on the job. This is what you're supposed to be doing. Please, please reach out. I will show you the background data. I will lay out the groundwork for you. I would be happy to be able to hand this work off to somebody who has a team behind them who could really run with this. So again, limited, but there is potential here. Okay. I think we've covered a lot there. I know normally I leave room for questions, but I hope I imparted to you a glimmer of an understanding of how stem cells actually work to heal damaged tissue. They're not turning into new neurons. Okay. They're helping damaged neurons that are marginally functional or non-functional get back online. That's what they're doing, based on the current science as we understand it, okay? If you have questions, this is my email. I put our admin email because sometimes when I'm busy and like I can get behind and I don't want, if you send me an email and I don't see it, send it to our admin. Our nurses are good at keeping on top of us. There are a couple of commonly asked questions that I'm going to go into now. But if it's kind of been too much, you can tune out and come back to this later. I'm going to address a couple of common misconceptions. Well, actually, I'm going to address exosome therapy and a couple of common misconceptions that I think are important, and then that's the end. But I wanted to give you an opportunity to kind of take a break because I know we covered a lot of heavy stuff. So first off, we get a lot of questions from parents. I'm going to cover the top three. The first one is exosome therapy. What are exosomes? Okay, we talked about how a stem cell, when it comes in contact with a damaged cell, the way it heals this damaged cell is by secreting exosomes. Okay, exosomes are bundles of protein and microRNA that open up options to the damaged cell that the cell doesn't have on its own. And there's a very scientific biological explanation behind that. I guess I'll go into it because I'm mentioning it, but I don't want to lose, the forest for the trees. But when a cell differentiates, let's take a neuron originally, it comes from a stem cell originally, right? The embryo is developing, stem cells are differentiating. You get a body of neurons. Those neurons are neurons because there's certain components of its DNA that are locked off to it. The DNA in the neuron is exactly the same as the DNA in the stem cell. But the only difference is that the neuron is expressing a program that is predetermined at the time of differentiation when it becomes a neuron. When it becomes a neuron, what the biology says is you no longer need access to the stuff that liver cells need and stem cells need and kidney and white blood cell. You don't need that stuff. And in fact, if you have access to that stuff, it's going to mess you up. You're going to go all kinds of haywire and do things that could be, frankly, a disease state. And so what happens is when a neuron differentiates, there's significant portions of the genome that are locked off. It's done, key is thrown away. You don't get access to that anymore. A stem cell has access to a much more, a totipotent stem cell or a stem cell that is in an embryo before there's any differentiation. That can turn into anything. It's got access to the full genome. Okay, and again, I'm simplifying, but this is sort of what's happening in the biology. Once it differentiates into a mesenchymal stem cell versus a hematopoietic stem cell versus, there's multiple different types of stem cells. There's a smaller portion of the genome that's locked off that it doesn't have access to, but a mesenchymal stem cell has access to more of the genome than the neuron. And often to heal, the neuron needs access to components of the genome that it's not allowed into that room. And what the microRNA does is it's not giving DNA or new genetic material to the neuron, but it's letting it use a component of the genome for a short period of time to enable that neuron to heal in a way that it can't because it doesn't have access to that healing program. And the stem cell does that by giving it to the damaged cell with exosomes, okay? The neuron can now use that microRNA for a limited period of time to enable it to do whatever it needs to do to heal. And we don't fully understand this process. The body knows how to do it better than we do. No big surprise there. But that's what happens when the neuron gets access to a set of genes that can help it heal in a way that it's not able to do on its own. Suddenly these cells come back online and they can divide again and form new connections. And so what exosomes are, what exosome therapy is instead of giving the stem cell and allowing the stem cell to secrete the exosomes, you can harvest stem cells from a variety of different places. You can take it from placental tissue, you could take it from umbilical cord tissue, you could take it from amniotic tissue, you could take stem cells from umbilical cord blood, you can take bone marrow that's donated from an adult, you could take fat that's donated from an adult, you could take any tissue that has stem cells in it, grow those stem cells in culture, and those stem cells secrete these exosomes into the culture media in which they're growing. That culture media can then be harvested and processed the same way amniotic fluid and placental tissue, which is very rich in stem cells, can be processed in a way that the exosomes that are present in those tissues can be processed out from the cells. And you know, it's a little more simple than this, but this is sort of what we came up with to demonstrate this process. Is you take exosomes that are secreted from cells in culture or exosomes that are naturally present in tissues, you process them out from the cells. There is a way to do this that prevents cell surface proteins from getting into the therapeutic product, that prevents somebody else's cells, usually through a process of ultrafiltration, where the exosomes are so small that you can filter out the cells, you can filter out the cells with the nucleus which contain the DNA, and just end up with a sterile batch of exosomes. The thing about this is that the technology is the point where you can concentrate the exosomes into the billions per cc, tens of billions per cc now. And so how long would it take a stem cell in vivo in a human being to actually secrete 10 billion exosomes? I don't know. I'm not sure anybody knows that answer. Would it take weeks? Would it take days? Would it take years? But the point is, you're concentrating the essence of the healing process into something that can be given in one shot. So it's sort of like a concentrated dose of the healing essence of the stem cell. There are pros and cons to this therapy. It's not right for everybody. It is the newest kid on the block, and therefore the most is unknown about it. And so there's more risk you're taking with this, I personally feel, than with cellular therapy. That being said, I've done exosome therapy on my, I've had Koshal inject me, okay? And again, I'll go back to what I said in the beginning of this talk, that I understand there's an inherent conflict, that I generate income from my practice. It's true, all doctors do. Therefore, the standard that I hold myself to is I would not do anything to somebody else or to somebody else's child that I would not be comfortable doing to myself or my children. And maybe maybe my threshold for risk is lower than others. But in my experience, once people understand how these therapies work, a lot of the hesitation and the fear dissipates, because it makes sense. And it's not that we have all the answers. We don't have all the answers, and we need help getting that. But when you understand what's really going on, you can then apply these therapies in a way that is reasonable, I personally feel. Two common misconceptions. The first one is what I call is mine are better than yours. So in regenerative medicine, this isn't just with pediatric brain injury, but this is with, you name it, degenerated knees, knee osteoarthritis, bulged lumbar discs, trying to regrow hair. The people who, most of the people who practice regenerative medicine pick a therapy, and that's what they do. They do bone marrow, or they do fat, or they do allogenic products, or they just do exosomes, and they get experience with that therapy, and then they try to say why that therapy is better than all the other options out there. And this is why I think it's really important that my background, my education, Koshal's education, where we come from, we hold ourselves to a standard. We're not better than anybody, okay? That's not what I'm trying to say, but we hold ourselves to the highest standards, not only in what we do here in the clinic, but outside of the clinic. Okay, if you Google search me, you're going to see, like, I train jiu-jitsu. I do it on a world-class level. That's the, two-time Masters World Champion Jiu-Jitsu. Why? Because I love doing it, and I want to do it right. Okay. Not only do I want to do what I do outside of my clinic right, even more so, I want to do what I do here right. And in my opinion, if you want to practice regenerative medicine, there is no one therapy for everybody. There are some people where bone marrow aspirate is the best option. There are some people where an allogenic product is the best option. There are some people where exosomes might be the best option. There are some people where exosomes are the last thing I would use, and I wouldn't even consider it. But if you don't have somebody who understands these therapies and how they're applied and how they've worked in dozens and dozens, if not hundreds of patients at this point, your options are limited. The tools that you're being offered are limited. And yes, I would say that most of the therapies we've done on children are adipose derived. There are a number of reasons for that. Again, that could be a whole nother hour lecture. But that's the one that we've seen the most success with. And I'm not going to go into it because it may turn out that at some point, one of these other therapies is actually better for pediatric brain injury. We don't know. Nobody knows. If somebody tells you they have the answer and they know, they don't understand what they're talking about. Okay. So misconception number one, we don't know what the best thing is. Okay. Someday, hopefully we will. Right now we don't. But if you want, my advice to you would be seek out somebody who has experience in a full complement of regenerative therapies because they work differently in different scenarios. Misconception number two, stem cells get stuck in the lung, don't give them IV, okay? Every published scientific report, controlled study, non-controlled study, cohort study, case report that looks at pediatric brain injury, cerebral palsy, hypoxic ischemic encephalopathy, you name it, they all have given IV stem cells, okay? Most of them have given IV cultured stem cells. And there's this rumor out there, not just in the pediatric brain injury population, but I get this from all over the adults who come to us for lung injury, for orthopedic injury. There was one study where they looked at mice and they used human stem cells and gave those mice human stem cells intravenously through a vein in the tail, which is often how it's done in mouse studies. And they looked for 1 day to where those stem cells went. They followed them for 1 day and they said they all got stuck in the lungs, they don't go in it. And they said their conclusion was all the stem cells get stuck in their lung. They looked at 24 hours, people, and they stopped. They were using stem cells that were from a different species and they watched them for 1 day, okay? This is a canine study. This is canine cultured bone marrow. These are dogs, okay? It's animal research. I'm sorry, I'm an animal owner myself. I love animals. It's part of, unfortunately, pushing medical technology. This is, and medical therapies. And so this is a canine study. These dogs had a catheterization where they were given a heart attack. So they ligated, they tied off one of the coronary arteries. They let it sit for 2 days. And then they gave these dogs IV infusions of stem cells because these were radio labeled and they tracked them to see where would these stem cells go. It's true that at day one in your body, you have two major capillary beds in your body, actually three, but if we're going to talk about large compartments, one of them's in your lungs, another one's in your gut, and another one's in your peripheral tissue. This is, I get it, very oversimplified. But when you give something through a vein, the first place it goes is the lungs. It goes through the heart to the lungs, and then the heart again, and it gets pumped out to the rest of the body. So the first place the stem cells stop is the lungs. It's true. They get hung up there for a day, for a couple of days, for a period of time. You saw how stem cells are able to migrate through tissue at the beginning of this lecture. They are not stupid. They're smarter than we are. They move through tissue in a way that we don't, we understand the basics of, but they are better than us, okay? Guess where they go day two? They're stuck in the splanchnic circulation, which is the capillary beds in the gut. Guess where they end up in a week? They're all in the heart attack, okay? They hone to the area of injury. Stem cells do not stay in the lungs. It's not just this study. I know this because the dozens and dozens and dozens, we're getting close to hundreds of people that we've enrolled in our studies that have gotten IV stem cells, IV adipose stem cells from everyone in their 80s down to, barely a year. Actually, yeah, less than a year is the age range that we've treated. And I can tell you from watching the clinical effects of what these therapies do is they exert their healing effect in the tissues that are damaged. they hone to the areas of injury, and they exert their healing benefits there. Okay. And so I know that's a lot. That's it. Again, I could go on I could do a whole 2-day conference on stem cells alone. I know you have a lot of questions. Shoot us an email. I hope, here's the take home. There's hope. What these cellular therapies are able to achieve for children with brain injury, there's a wide range. Some people get nothing. Some kids are super responders. Most people are somewhere in here and get a more modest improvement, but most people see some degree of improvement. I would love it if an academic center took over these studies. Please send me an email. I'll go over the protocols with you. I would happily hand this to you on a platter to take this over, but there's nobody doing this, and it's a tragedy, and it needs to be done. And I'm going to get on my soapbox here personally. Why? Because the next question is why aren't people doing this? Listen, you can't patent your stem cells, people. There's, people want to say they're charlatans doing this for money. The bigger problem is that if this therapy were able to be patented, you would see people all over the world try to be the first to get something through patented so they could control it for the next 14 to 20 some odd years. These therapies are not patentable. Therefore, the profit motive for devoting time and energy and money into researching them is limited. That's my opinion. But after years because I had the same question myself as a physician, I was like, why aren't people getting on board? Why aren't people more aware? That is, in my opinion, is why. And this is why we need the academics to really pick up the ball. I hope that was helpful. My heart goes out to everybody. Send us questions. Use us as a resource. We're happy to do what we can to help. I hope that really helped you guys. Thank you.